We present clinical case of continuous Lasso loop overlocking repair of horizontal medial meniscus tear. After the debridement of the tear, we insert the spinal needle with zero fiber wire suture through the skin from the posterior medial part of the knee in safe zone as described in classic outside-in technique. The tip of the needle initially penetrates superior part of the tear. We grasp the suture and correspond it through the anterior medial portal. After that, we pull the needle back until the level red zone of meniscus and then we penetrate the inferior part of the tear. This maneuver creates a loop and we pass the free end of the suture through the loop with probe or with suture grasper. On the next step, we pull the free end of the stitch which is passed through the spinal needle. After that, we tighten the stitch. We repeat this maneuver several times until we create the stable, continuous W-shaped configuration of overlocking stitches. In final stage, all stitches are checked with a probe and tightened if needed. At the end of the procedure, both ends of the sutures are corresponded to their anterior medial portal with suture manipulator, and classic non-sliding knot is created. The knot is placed under the inferior surface of meniscus for prevention of abrasion and irritation of the cartilage. Finally, stable construction is checked with probe. In case of vertical tears, the same technique can be successfully used and creates the solid repair.